So we are with Dr. Maria Carrillo from the Alzheimer's Association 2009 International Conference on Alzheimer's Disease. Thank you for being with us.
Thank you for having me.
We have been seeing that there's a lot of new studies coming out of the conference this year. One in particular talks about post-traumatic stress and veterans. Can you tell us about that?
We're really excited about all the new research that's come out this year for the International Conference on Alzheimer's Disease. And one of the studies that in particular was very striking was the one on post-traumatic stress disorder, indicating that veterans that had PTSD versus those who did not, there was an increased risk of Alzheimer's disease. This is something very new. No one had ever looked at that before, and it gives us an indication of the fact that stress can indeed probably play a huge role in Alzheimer's risk and an increasing risk. And not only just stress of everyday life, but stress linked directly to combat. This is very relevant today because we know there are quite a few wars going on right now, and not only are we aging, but we will also have an increased number of veterans in the next few decades. So it's something of concern and probably something we might want to pay attention to, and we definitely need more research into PTSD and its link to Alzheimer's disease.
And this would probably affect past combat veterans as well, maybe from Vietnam.
Very much so. This study was done at a VA medical center with a large study. Over 7,000 veterans were included in the study. So it's definitely something that we should think about in terms of diagnosing PTSD, and then along with PTSD diagnosis, perhaps looking at cognition in those veterans.
Now, some people may hear or read quickly that there is some favorable information between alcohol consumption and slowing down cognitive impairment. Can you make sure that we understand clearly what that connection is?
Absolutely. There was a very exciting study that showed that alcohol use in very light to moderate use showed a protective effect and a decrease in Alzheimer's disease or in dementia. This light to moderate alcohol consumption is actually quite light. It is perhaps 1 to 2 drinks a week, and certainly not perhaps a light moderate consumption of maybe 10 drinks a week. So we really need to keep that in mind. The light to moderate consumption actually showed less risk in Alzheimer's disease than no alcohol consumption, but it was also very clear that a high alcohol consumption was detrimental and actually increased your risk of Alzheimer's disease. So these are very important facts for the public to know.
And once you have Alzheimer's disease, or once a person does have Alzheimer's disease, does the alcohol have any effect on slowing the disease?
Actually, we have this same study showed that people with mild cognitive impairment, which has been considered to perhaps be an early state of Alzheimer's disease, had very negative results when they consumed alcohol. I think that's something that is very much worth considering additional research for, but for now is a warning for those who have been perhaps diagnosed with mild cognitive impairment or are having memory problems, that perhaps alcohol consumption, any alcohol consumption in that population should be curtailed.
And we are hearing some really exciting research about biomarkers, and if I understand it correctly, biomarkers are things that you can see on an MRI scan or a PET scan, is that right?
Biological markers, which are for short biomarkers, are indicators of disease without a clinical diagnosis, so without paper and pencil tests that you would have to take at a doctor's office. So we're very excited that at the Alzheimer's Association 2009 International Conference on Alzheimer's Disease, we have several studies indicating that there are potential biological markers that could help us with an earlier diagnosis. These are magnetic resonance imaging technologies, MRIs, or positron emission tomographies, PET scans, that can perhaps take pictures of the brain, and we can make a differentiation between a person that has Alzheimer's disease and does not have Alzheimer's disease based on those pictures. That's again very exciting because today we are diagnosing Alzheimer's disease much later than we want, once memories are already gone. We know that in order to intervene and to make a difference with therapies, we need to diagnose Alzheimer's disease before those memories are erased, because we cannot get them back. So we're very excited about the potential for biomarkers and early detection of Alzheimer's disease.
Thank you. We have one last question. One of the studies actually shows, though there has been lots of information for many, many years out about the risk factors and about reducing the risk, that really the general population seems to know that it's not a curable disease, but they really don't know what they can do to reduce their own risk of getting Alzheimer's disease. Can you tell us what they can do?
Sure, absolutely. For many years, we have had hints, and many studies have shown that modifiable lifestyle factors can indeed decrease the risk of cognitive decline and dementia and Alzheimer's disease. At this conference, our Alzheimer's Association 2009 International Conference on Alzheimer's Disease, we did have several very exciting studies telling us that some nutritional factors are very important, and perhaps physical activity very important. First of all, we had a DHA study telling us that in a normal population, over time taking DHA, they showed a decrease in cognitive decline over time. In addition, the DASH diet was reported at this conference, indicating that fruits and vegetables and nuts, and then a decrease in saturated fats also can help reduce your risk of Alzheimer's disease. And several studies at this conference reported that exercise and physical activity could potentially decrease your risk of dementia and Alzheimer's disease. So altogether, reaffirming what we know that haven't shown before, that cardiovascular risk factors, when controlled, which are definitely modifiable in a lifestyle change, can indeed help reduce your risk of Alzheimer's disease.
Eat right and exercise is the bottom line, right?
Absolutely. What's good for your heart is definitely good for your brain.
Just one last clarification. DHA, can you tell me what that is? Is it something to do with fish oil?
So DHA can be gathered from fish oil. It is an omega-3 fatty acid. It is an essential component in cellular health. Brain cell health is in addition, and actually it can come from various other sources. The particular DHA used in the study reported here at the conference is from algae, which of course the fish eat, and so when we eat fish, we get it directly from the fish, but you can also get it from other sources.
Okay, thank you so much for your time.
Thank you.